community leaders who will work together with the community to raise the awareness of cancer and the importance of early screening, early detection for cancer diseases, leading to effective treatment, and of course then better outcomes. It is estimated that the campaigns will reach over 1.8 million people. We also are looking forward to being able to participate in research projects that will give us informed information to help us come up with strategies that will improve the situation of cancer in this county. We are very excited that our Excellency has promised with the county leadership here to support the Aga Khan Hospital Kisumu as an implementing partner, working with its partners to journey towards improving the situation of cancer in this region. And so as we've signed off the MOU today, we are looking forward to getting started and will be part of this county for the next 4 years. And I want to trust that at the end of the 4 years, we will be able to look back and say, indeed, we've been able to achieve what we started. Together with me is part of a member of our partners, and I'd want to invite her to speak to the participants.
Good morning. Thank you, Your Excellency. So I'm Angel Chapri. I'm the director of AFD, French Development Agency here in Kenya. And I'm very happy and proud to be here today. For the signing of this MOU. For this very important project. I'm sure that this project will deeply improve the lives of women here in Homa Bay. We know that the team here is very much involved in this project. So I'm really looking forward to seeing the results that will be shown in the next couple of years, and I'm sure we'll come back to see the new infrastructures as well. I'll be very happy to go and look with Your Excellency at the infrastructures, at the result with the project, and then think about the future together here in Homa Bay. Thank you very much.
Thank you. Thank you very much, Angel, and thank you very much, Madam Jane. And I also want to really thank our team, our health team, for the work they have put in behind the scenes to ensure that today we have successfully signed an MOU that will radically change the lives of our people. Today in Homa Bay, we are unable to provide chemotherapy services, but from our discussions, within the next 3 months or so, at the Homa Bay County Referral Hospital, we will be able to provide chemo services to patients from across Homa Bay and elsewhere that will be coming here, and that will be a very, very big step forward through this partnership with Aga Khan Hospital and with the FD and the Gates Foundation. Apart from that, the old adage goes that prevention is better than cure. And right now, as a country, we are implementing the universal health coverage, and we are putting a lot of emphasis on primary health care and community level health. And therefore, we are happy that this program will be supporting community engagements, sensitization, screening, so that cancer can be detected early, both cervical and breast cancer, which are the most common cancers here, can be detected early and dealt with at an early stage rather than waiting for when the cancer has progressed, and sometimes it is impossible to reverse. And therefore, as Homa Bay, we want to give our commitment to our partners that we will put our best foot forward through our team, a very, very vibrant team of health that will work with your teams to ensure that all the numbers that are targeted, we will not only meet them but surpass them. But most importantly, that this program will be felt on the ground by the people of Homa Bay. So we are once again grateful that a program that is running across East Africa, Tanzania, and Kenya, that in Kenya, when it arrived in Kenya, at the border in Hispania, it arrived in Homa Bay. I think there is no bigger privilege and honor than that, because there are many other counties that you could have been in, that it could have gone to, but it came to Homa Bay. And for that we thank you, and we assure you of our full support, and we hope that in another 4 years when we stand here, we will be giving the people of Homa Bay the results of this very important program and the lives that it has saved. Thank you very much. We'll take questions, if any.
About what would be the best way to deal with stigmatization, especially in the rural areas? As we've been covering cases of cancer patients, most people treat it as a curse in the traditional way, and some use herbs to treat it, which deteriorates the lives of the patients. What do you have in place that would curb the stigmatization and lack of information, especially in the rural areas? Then secondly, I would request the governor to use this platform at least to highlight the developments that have been done in the county ahead of both the Madaraka and the devolution conference. Thank you.
Jen?
Thank you for your question. How do we deal with stigma? I think the starting point is just what we are doing today, that make people understand that cancer is not a death sentence. And that's why community engagement is going to be very, very important. As you heard what I mentioned, the people that we are going to reach out are not just specific people. We are looking at community health promoters. We are looking at journalists like yourself. We are looking at spiritual leaders and anyone out there that can be able to speak about cancer and what cancer is. And especially getting to know that even if one is diagnosed with cancer, it actually can be treated. We will also work with support groups. We have survivors today. We have people who are being able to stand out there and say, I had cancer and here I am. And so with that, we trust and believe that with your support, with everyone being knowledgeable enough, we'll be able to continue singing this song, that cancer is not a death sentence. There's merit in detecting early and seeking treatment early. And remember, for prevention, we're even saying we can go to the children, girls at 9 years, be vaccinated so that we can be able to prevent this disease. So it's a matter of us working together. I do not think it's a one-man show. It's not, no one person can be able to destigmatize the impression about cancer. It's all of us coming together and speaking that same language that we can conquer cancer.
Yeah, I think that is very well covered. And I think the more we engage with our communities and opinion leaders, the more we demystify cancer. But also, the more we provide care services, the more people are not afraid to come out and get treatment. And the more our outcomes become better, and the more our outcomes become better, the less scary cancer will be. And we are happy to start this process here at the referral. And we are happy that as a county, we also have plans underway that when resources will be available, we will be developing a cancer center at Nyagoro. I think we have the plans, we have worked with the public works, and we hope that this is part of the legacy that we will be having here in Homa Bay in our 10 years that we will be here, God willing. On the second question of Madaraka Day and Devolution Conference, I want to say once again that Homa Bay is greatly privileged this year to host many high-profile national events. Just last week, we have concluded the Kenya Youth Sports Association Games that were held in Asumbi, and all our counties were here for those games. Before that, we held the national celebrations for the International Women's Day. And on Sunday, 1st of June, 2025, the whole country will be hosted here for Madaraka Day celebrations, the first that Homa Bay will be hosting in the last more than 60 years of independence. Later in August, on 12th to 15th of August, Homa Bay will once again be the host of all 47 county governors, senators, MCAs, CECs. The whole country will be here for the Devolution Conference 2025. And I'd like to say that currently a lot is going on in Homa Bay. In partnership with the national government, we have the stadium right now working day and night to conclude all the terraces. We have our main highway here in Homa Bay will be dualed so that it becomes a dual carriageway. If you go to the lakefront, the pier is being completed as part of the Blue Economy theme. The fish market is concluded there, and we hope that the second phase of the pier under KPA and the Kenya shipyards will also be going on. In the town here, every corner, ukikata kona hii, barabara inafunguliwa, inakuwa laminated. The roads are being laminated in every corner of Homa Bay town. We have more than 15 kilometers of road within the town being lamed. The Wahambla to Imbo Road, laminated. The one from Ruga to Lala, laminated. I can tell you that the investment that is coming into Homa Bay, without mentioning the diversion of this main road to create room for the Kabunde airstrip to be extended to 1.8 kilometers. Currently, if you go to Kabunde, the runway is being extended, the parking area is being done, the apron is being done. We have been landing on grass. We will now be landing on actual tarmac. And so I want to really take this opportunity to thank His Excellency President William Ruto and his entire team for choosing Homa Bay to host this year's Madaraka Day, and putting in partnership with the county government the effort that we are seeing to improve the face of Homa Bay town. And a lot is also going on in the other sub-counties. I also would like to mention, I know that our people are facing a lot of suffering on the road from Kadel to Kanyadiang. The contractor is mobilizing and coming on site, and we hope that within May, when the rains subside a little bit, the contractor will be on site. I also want to address our people of Sindo, that the main road from Magunga, Sindo, I know that they have faced suffering there, but we have spoken with the national team, and the contractor has been asked to do maintenance before works so that they can come and also clear Nyabera to Sindo to Mbita so that it is passable. And the other road from Koguta Junction to Nyabera, it is not a county road, but we have agreed that we are going to support in doing spot improvement as we wait for the national government to come and cover it, because we are the government of the people. We are the local government. We are the government of the ground. So even if it is not ours, we will do it. Koro awach gidolu. Okay. Koso Kiswahili. Koro ado wacho ni igani Homa Bay nigi yawi maduong. Mokuongo nyore ka wabedo gi games mag kisa, Kenya Youth Sports, Kenya te ni asumbika kobire sport mar kisa. Kenda adwa congratulate teams wa Homa Bay ka nye wakao kikombe, nye wa yuero, nye ber kabisa. Makweni be nyokawo moko, okrach, moko gikawo, moko wambe wakawo. Igani wadhi bedo gi Jumapil tarik 1 dwe mar 6 nyaka nouru chakre, nyaka nouru yude piny ka. Igni 60 koro dhi ka rumo. Homa Bay dhi bedo host mar Madaraka Day ma 2025. Wamorgo kabisa. Kendo sani tich oruko Homa Bay ka. Stadium kidhie odiochieng' gotieno tiyore kendi tieke. Kibire ndara maduong' maluwo dier Homa Bay ni, ndara ni idwa ket koro bedo dual carriage. Tiene ni ng'ama ringo kocha ok nere gi ng'ama ringo koni. To taya be rienye diere kanyo te maonge jo maundu makoro yudi. Ei town ma Homa Bay ka kamoro ka kamoro kilomita 15 mag ndara iyawo. Kidhi affordable housing kachi iyawo, Masofia ka iyawo, Shauriak, nderni iyawo e town ka. Kendi dwa yaw kendi kete stima kendo Homa Bay koro rieny ka city. Kidhi e dho nam paya osetieki, tije mamoko matindo tindo monego tie e dho nam kanyo be idhi timi magero office mar KPA ka. Ma jowa be ndiki, koro jowa be dhi wacho ni atiye port. Kodhi chiemo kata kodhi kamin bleto wacho na wuok atiye port abiro. Mano gima lich. Paw ndege iyawo. Sani ndeke makoro madongo be nyalo biro Homa Bay ka. Koro adwani ago erokamano ahinya ne president marwa. To gi baba Raila Amolo Odinga nikech ne giwinjore wachni. Mondo Madaraka Day okel ka. To bende mondo yie ni projects gi te kwariwore gi county government mondo timre ka. Jomoko aneno ka wacho ni projects gi magi mag national government inda kiwachi Homa Bay osebedo ka igni koro ji otimo osetho. Dak ne time gigi omera gigi nyaka many nyaka dwer. To Homa Bay nigi yawi noyiero governor ma jadwero. Koro wadwero koni gi koni to gigi biro. Nikech mano tija mondike katiba ni tija en dwero ne Homa Bay. Kopogore gi tiyo ne Homa Bay, dwero ne Homa Bay. Tago erokamano ne jotend Homa Bay te. Kamoro amora ma gibede, wan gi CS mar Treasury, wan gi PS mar Interior, wan gi wabunge wa mwatiyogo MCAs, jotelo te. Nyo wacho ni onge pogruok e gini, ji oriwre te. Koro adwa kwa jowa, wariwre uru. Kik wasik ni manga, wakia manga, ne kia maotimore nade, mago kony, jotelo koriwore to kelo dongruok. Koro jopiny kik pog jotelo, giwe jotelo riwre mondo dongruok otimre nade, obi. Ber koso rach? Nyawang'aya dire koso dire? Igni 10 koso matin? 10 nyaka giko, koso unu neno gido nango? Bas, koro anatieko wechego. Gima duong' bende manyaka wachi en ni theme mar Madaraka Day en blue economy. Koro adwani mondo wachi ni sani beaches osetieko yiero BMUs magwa. Koro wadwani wariwre kodgi te mondo wago mbaka ni ere kaka wanyalo konyo nambwa ni mondo rech owuogi. To be kik walupi ka gima wane mwalupo mogik. Walupo kwa ng'eni wan walupo kawuono, nyithindwa kwiny ne lup kiny, nyikwawa nyaka nyikwagi be bro lupo mbele kucho. Koro mago mbaka te mwabro goyo under the theme mar blue economy. Ere kaka mine nyalo bede blue economy? Ere kaka jomatindo nyalo bede blue economy? Mago te wabro go mbaka go. Nyasaye ogwedhu. Picha. Ai. To picha kwase go kucho.